Good morning. I'm Dr. Sandeep Tandil. I'm a general and laparoscopic surgeon. Today's topic I have taken is ingrown nail. So, what is ingrown nail? How patient will present? What are the investigations? How we treat it, and how to prevent this condition? We'll discuss. So, what is ingrown nail? Ingrown nail means the nail plate starts going deeper into the nail pit, and that starts producing the pain, redness, and the problems. So which nail is most commonly affected? Now out of our hand nails and the foot nail, mostly the nail of the great toe, that is the biggest toe of our foot, is most commonly affected. In that outer part of the great toe, the outer part of the nail bed, like suppose this is the inner part, I say the outer part of the nail will be most commonly affected. So which age group is more commonly affected? It's young adults. Why in young adults? Because they are more active. They are active so that the more perspiration happens, like more the sweating happens in the foot, the nail bed becomes soft and the nail can get injured in that time. It can happen in the other age group also, except for the small babies, because this condition happens once the person starts walking. So as I told, most commonly affected is the great toe of the foot, but it can happen in other part of the other toes, or it can happen into the hand also. Now we will discuss what are the reasons why it happens. Suppose you are cutting a nail and you are cutting it very short. Like suppose this is a nail and I am cutting it very short. So I am cutting it very short, like till here. That means I am exposing the nail bed, and in that condition the nail might start growing deeper inside. Another thing is if you are wearing very tight shoes. If you are wearing very tight shoes, like ill-fitting shoes, and there is very less space for the toenails, like foot toenails, to spread properly, they will get cramped in one place. So once they cramped in one place, there is too much of pressure while walking because of the body weight and the shoe pressure on that. Nails, the side of the nails start going deeper inside, and it will injure. Then this condition is also common if the nails are more curved. If there is a nail injury because of the trauma or some accident, if you got a nail injury, that can happen. This condition becomes more problematic in the people who are diabetic or who have less blood flow in the legs. So next we'll discuss is there are 3 stages of the ingrown nail. Stage 1, what happens is your nail, the side of the nail, it will become mild pain. You will feel, you will have some redness in that area, and in the stage 2, this pain will increase, the redness will start increasing, and it will become more painful while walking also. And stage 3, what happens is bacterial infection happens in that area, or there is a granulation tissue, like the one small outgrowth you will see in the side of the nail, because the nail has digged deeper inside, and the nail, as it goes into the nail bed, it gives a foreign body type reaction, and body responds to it by forming a granulation tissue, that is a swelling in that area. So you can see something reddish growth which is coming out from the side of the nail. That's a stage 3. So as we have discussed already, the symptoms will be, patient will be having pain while walking, there will be redness in that area, sometimes there will be discharge, sometimes pus discharge can happen from that area because of the bacterial infection. These are the things, and most often because of the pain in that area, the patient will go to the doctor or they will try to treat the condition. So what are the investigations, if you ask me? Usually it is a clinical diagnosis, like the doctor will see and he will diagnose that it's an ingrown nail. Whether it is infected or not, doctor will, after looking at only, he will advise you. One investigation which can be done is X-ray. Why X-ray? To see the underlying bone. Sometimes the infection of the bone should be ruled out if the nail is too deeper inside, and to rule out osteomyelitis. Osteomyelitis is infection of the bone. So that sometimes doctor might ask you to get an X-ray of that area. Now the treatment, if you ask me, initial time, like if you got an ingrown nail and it is just little bit swelling is there, mild pain is there, doctor might prescribe you some antibiotic creams. He might advise you to take oral antibiotics, painkillers to decrease the swelling, and doctor will advise you to avoid using ill-fitting or tight shoes, to take care of the nails, to take a sitz bath, like soaking the nail put in the warm water for some time. That might help in decreasing the swelling and infection. If this initial treatment doesn't work, the next treatment will be the surgical treatment. Chemical treatment is also there. Chemical treatment means matrix. Matrix means nail have a different parts. The nail matrix is the part from where the new nail grows. So the lateral part, like suppose this is a nail and the matrix will be below this area, so that from this area the nail grows out. So that is the area where the nail starts growing. So the lateral part where the nail is going inside, that matrix part can be destroyed with the chemicals such as phenol. So what happens is the lateral part of the nail doesn't grow, only the center part of the nail grows. But with this treatment, sometimes recurrence can happen. So the definitive treatment or more better treatment with less recurrence, I will suggest is surgical treatment. So surgical treatment, what we do is, it's a daycare procedure. When you go to doctor and once it is diagnosed, it is an ingrown nail. So the treatment are two options are there. Some doctors prefer to remove the entire nail. They will remove the nail bed, and next time when the new nail comes, you have to take care of a nail, like cutting the nail at the correct. You have to cut it straight. Do not cut on the sides. Don't make it too round, or else nail will start growing inside again. Then avoid tight fitting shoes or too much of pressure, so that the nail comes straight and it doesn't bend. And other treatment which we prefer is the partial nail removal. Partial nail removal means, suppose this is a nail, so we don't touch the center part of the nail, only the side, like inner and outer part, 1 to 2 millimeter of the nail. There is a matrix. As I told, matrix means the part from where the nail grows. So the matrix, the outer part and inner part, around 2 millimeter of that matrix we remove mechanically by removing that part of the nail plate, and going deeper, remove it. The center part of the nail plate will be still present. So next time what happens is, your nail will come straight in the middle only, it won't come on the sides. But still the care you have to take is, when the nail grows, cut it straight, do not cut on the sides, and avoid using tight fitting or ill fitting shoes, so to avoid the pressure on the nail. And this way this gives more better results, and it has a less recurrence of ingrown when it is treated surgically this way. After the procedure, doctor will ask you to go immediately, like within 10 minutes after doing the dressing. You have to remove the dressing next day and reapply the dressing. You might have to do the dressing for another 2 to 5 days till the nail heals in that part. Doctor will prescribe you some painkillers and antibiotics for a few days, and after 5 days, once it is healed, then there is no need of any dressing. So once again we will discuss how to prevent it. If you don't have ingrown nail, it's good, but you should take care of a nail. If you are using ill-fitting or tight shoes, please avoid them. You should have adequate space in the front of your shoe, so that your toes are moving freely there in that space. Then when you are cutting the nail, do not cut them too short. Cut it at the level. Then cut only in the front. Don't cut on the sides. Don't make it too round and shape. And if you have a nail injury, please meet a doctor and get it corrected, treat it properly. So if you have any doubts about ingrown nail, please write in a comment box. I will try to explain and give more details about it. Thank you for listening to me. Thank you very much.